Hi everyone, welcome to NGNC. In this video, we will talk about one of the most important topic in the NCLEX-RN exam, even in the nursing school, NCLEX prioritization. So NCLEX priority, sometimes 60 to 70% of your exam can be on prioritization. So if you're a repeat test taker or you're going for your NCLEX-RN exam first time, must know how to prioritize. So basically, we will be looking for the safest answer possible, safety plus critical thinking. Students who are struggling to pass their NCLEX-RN exam because they don't know how to prioritize their patient. You'll be having multiple patients during your shift, right? So it's not possible. You cannot give one-on-one care. Sometimes you have to prioritize according to the condition of the patient. That is the idea they're bringing to the NCLEX questions as well. They'll be giving you the 4 patients. You have to choose one patient who is on the most priority, most unstable patient, most critical patient. Because as a nurses, we want to save our patient life. In this video, I will show you what are the keywords you'll be looking for when you're solving the prioritization question. We know NCLEX-RN exam can be tricky and they will never give you the direct word priority. They will give you some keywords. You need to figure it out if it's a priority question. For example, you'll be looking for most concerning, requires immediate follow-up, first or firstly, urgent or urgently, immediate follow-up, initial, first, most important, highest priority, best action, next action. If you see this word, if you see any word from these keywords under question, it means they want you to choose a priority question, the patient you will see first basically. So how to read a question? It is very important to understand how to read a question properly in the NCLEX. Sometimes students are not even able to understand a question, but they want to answer that specific question. It's not possible to choose a right answer without understanding a question. So first thing first, understanding a question properly. For that, we will be looking for a verb keyword. We will be looking for keyword from these to understand type of question, because under question they will give you some information about the patient, age, gender, diagnostic test, current condition. Most important thing is a current condition. If somebody is unstable currently, no matter what, we will be treating that patient first. For example, if they show you the keyword now, sudden, new diagnosis, post-op, especially less than 12 hours, any worsening conditions, so it means it is a priority. If we see any, if under options we see these words, that patient can be our priority, so we find a clue. Next, we will see unstable before stable. If patient is currently unstable, as I mentioned earlier, if patient is not stable currently, that patient will be our priority. Any acute condition over chronic condition, we will be checking the ABC, airway, breathing and circulation. But sometimes it's not important to find an answer only by ABC. There are few things we will keep in mind, and there are types of priority questions. Some can be ABC, some can be acute versus chronic condition, and we will be reading about Maslow hierarchy needs as well. So we will be checking airway, breathing and circulation. Any life-threatening condition, unstable or unexpected findings will be our priority. So let's compare these options and let's see what will be our answer here. For example, if they give you the 4 patient, chronic COPD but stable. So chronic COPD but stable. Post-op day 2, shortness of breath. All of sudden shortness of breath. Hypertension but controlled. Diabetes but stable glucose levels, stable blood sugar levels, right? So second will be our answer. Here I mentioned we will be choosing priority to those patients after surgery within 12 hours. But if the patient is unstable after 4 days of surgery, having shortness of breath, that is an airway problem. That is automatically will be our priority. Airway is our number 1 priority. If patient is not breathing, even if we treat other things, it will not make any sense. So second will be our answer. So any post-op patient within 12 hours, we will be worried more about that patient within 12 hours, because after surgery, we are worried about bleeding. We are worried about hemorrhage. So we will be monitoring those signs and symptoms of bleeding. After 12 hours of surgery, patient will be considered stable if they don't have any other complication or other signs and symptoms. Next, lab values. If somebody is having low potassium, BUN and creatinines are really high or low, if somebody's blood sugar levels are not good, if somebody's platelets are really high, it means we will choose that patient as a priority. Most important from these one is a potassium and blood sugar. For potassium, they can test you for your NCLEX and LVN, because whenever our patient is having an altered level of potassium, it will put impact on heart of our patient. Heart and mostly ventricular fibrillation, so dangerous. Mostly ventricular fibrillation. So we will be monitoring our patient potassium levels. So whenever we see potassium levels high or low, that patient will be your priority, because we are worried about heart of our patient. Next, we will be reading with an example. If you're NGNC student, you know after each topic we will be practicing questions and I will teach you with examples. That's how NGNC students are able to crack their NCLEX only in couple of weeks. So we have an asthma patient using accessory muscles to breathe. So this is our keyword here, accessory muscles. We will highlight it. Second patient, we will compare this option with the second. Post of patient with high heart rate and BP is low, 86/58. From these two patients, one patient is having sign and symptoms of hemorrhage. Anytime our patient heart rate is high, blood pressure is low after surgery, they will give you this word after surgery. It means we are worried about bleeding inside. Hemorrhage, we are worried about bleeding. So one patient is bleeding, here is a hemorrhage, and one patient is using accessory muscles, asthma patient. It means maybe patient is having hard time to breathe. So we will eliminate this option and we will compare first with the third. Patient with a broken arm and severe pain but stable vital signs. So one patient is having an airway problem, second patient is having a severe pain. Remember, pain will never be our priority if patient's vitals are stable. So we will eliminate this option. Now we are on 50-50. We will be comparing first option to the last one. Patient is having appendicitis pain, which is very severe pain, and waiting for surgery. So this patient is already diagnosed and waiting for surgery. On the other hand, we have a patient, asthma patient, using accessory muscles to breathe. So that will be our answer. Number A, number 1 will be our answer. So using accessory muscles, anytime you see drooling, grunting, anytime they give you the word nasal flaring, these are the keywords. Patient is having a airway problem, our number 1 priority. Next, we will be reading about Maslow hierarchy's needs. So कई बार ये important नहीं होता कि आपको prioritization के answer A, B, C में से ही मिले. So you need to use sometime Maslow hierarchy needs in your question. So you have to figure it out. Are they asking me about ABCs or are they asking me about Maslow hierarchy needs? So I will teach you the easy way to remember this. You don't need to memorize it. You need to understand it. Physiological needs comes first instead of psychological needs. So number 1 priority here under Maslow hierarchy needs, physiological needs. Physiological needs क्या क्या होती हैं? Airway, nutrition, heart rate, oxygen, elimination. So we will be taking care of these things first before we take care of something else. Second is safety and security. Under safety and security, we will be protecting our patient from injuries. For example, fall precautions, right? We will be putting our patient for fall precautions, any infection controls. But think about it. If they give you 2 priorities in one question, how you can differentiate? If somebody is having lack of oxygen, on the other hand, patient is at risk of fall, which one you'll be priority? You can drop an answer under comment box. Of course, if somebody is having lack of oxygen, that will be our priority instead of somebody who is at risk of fall. We can protect this patient. Secondly, we will see this patient. Next is love and belongingness. Under that support system, for example, self-worth, body image. For example, respect, confidence, and self-worth. How they can test you for love and belongingness? One patient they can give you, one patient is having a risk of fall. Another patient they give you after surgery. Patient is worried about the body image. So one patient is worried about the body image. Another patient is at risk of fall. So maybe the patient who is at risk of fall can lead to severe injuries, including severe fractures or injuries. So we will be taking care of this safety and security first before we take care of body image or we provide education, love and belonging. Then self-esteem, and lastly spiritual well-being. So basic needs always comes first, then psychological needs. One trick you can follow in your NCLEX-RN exam, they will try to trick you with the pain. They will be giving you severe pain. For example, we talk about the question here, broken arm plus severe pain. But pain will not be your priority if the vitals are stable. If patient is breathing and patient is suffering from pain, we will be looking for the patient who is having a hard time to breathe. So we will save that patient life, because this patient only need painkillers, right? Pain medication. Of course, we will assess this patient later on, but first thing you need to take care of physiological needs, oxygen, airway, breathing, nutrition. So whenever you're in doubt, you have to pick unexpected finding. For example, with pneumonia, fever is expected finding. So we will not choose that as a priority. But with pneumonia, they're giving you hard time to breathe using accessory muscles. That can be our priority. Next, choose what has changed. For example, before our patient was stable, but now something has changed. That will be our priority. Whenever you're in doubt, go with common sense. How you can go with common sense? We will be looking for first level priority, second and third level priority. Under prioritization, why students are having hard time? Sometimes they feel everything is priority, or especially two answers are priority, and it's really hard to differentiate between those two answers. That time, go back to your question, read your question again, then you find out the right answer. So first level priority, airway, breathing and circulation. Secondly, pain, any acute pain, any abnormal labs. For example, they can test you about potassium levels, they can test you about BUN and creatinine, which will be impacting the kidneys. Any altered mental status, any deliriums. Third, education, rest, after surgery educations, discharge educations, that will be third. Admission versus discharge. Patient who is admitting to the hospital will be priority because they're unstable, they're coming to the hospital for a reason. But on the other hand, patient is discharging home, patient is stable, so we are sending patient home. So that will be last priority. So the last tip I want to give you in this video, assess first if no immediate life-threatening. Assessment will always come first if there is no life-threatening condition. Think like a nurse, act like a lifesaver. That's the NCLEX priority mindset. So if you're thinking like a nurse, acting like a lifesaver, because on the floor, this is exactly what we are doing. We have to think like a nurse during the exam as well. That's how NGNC students are cracking their NCLEX only in 7 weeks. Subscribe and share with the friends who are struggling to pass their NCLEX. And you can contact me on the given information to join our next batch.